All the surgeries that we do to treat stones have the potential to leave fragments behind. And some of those fragments, especially if they're small, they clear usually pretty quickly. But the ones that stay and hang out, especially if they stay in the bottom of the kidney, they have the potential to grow and get bigger and lead to another event down the road. This would be an option to be able to, in the clinic without any anesthesia, have a procedure or two that takes about 20 minutes or 30 minutes, something like that, to try to get some of those fragments to get up and clear out. There's no other device or technology like this that's out there, and so as a part of that process, we actually had to set the goalposts and decide what a meaningful metric would be. And so I think thus far the numbers look really good, and I think we're going to meet our goals. I've had 3 stones myself and 1 procedure to treat stones, so I'm definitely familiar with the discomfort and the pain that they cause, the side effects from stents when you have a procedure and you need to have a stent in your ureter. I've had one myself, and I think that anything we can come up with that is going to be as effective or less invasive than some of the technologies we have now, maybe more successful and not require anesthesia, I think that's a really exciting future. Some of our funding has come from NASA, and they're interested in stones because it is if the plan is a manned mission to Mars or deep space at some point, stones are a real concern because with the weightless environment, there have been astronauts that have had stones develop during, at the space station or during space flight. If you're really unlucky and a stone decided to try to pass in the midst of a space flight, you'd have this technology to potentially be able to try to push it back, relieve an obstruction.